Hi everyone, I'm Kady Myers and I'm going to be talking to you today about poverty and health in Canada and a recommendation for a poverty intervention tool for the province of Nova Scotia. So I did my practicum placement at the Canadian Centre for Policy Alternatives, and the CCPA is an independent, nonpartisan, not-for-profit research organization. I would strongly encourage all of you to check it out. They're actually one of Canada's leading sources for progressive policy alternatives and ideas. They have offices throughout Canada, and I did my practicum in Nova Scotia, the Nova Scotia office, and I was supervised by the director there, who was Dr. Christine Slanier. I had a wonderful practicum experience. I actually was able to contribute to a lot of different projects during my placement, and this really only captures a small portion of what I did on my placement, but it's very exciting nonetheless. So for this project, I did a literature review. I used the databases such as CINHL Full Text, Web of Science, the University of Victoria's library website, Summon. I also was focusing on Canadian data, so I predominantly looked at Canadian government websites such as Statistics Canada. So my literature review focused on the connection between poverty and health, what poverty is, the current state of poverty in Nova Scotia right now, and a recommendation for a poverty intervention tool for the province of Nova Scotia. So the purpose of the background information was to support this poverty intervention tool, which is being discussed for implementation in the province of Nova Scotia right now. So the Public Health Agency of Canada denotes income and social status to be actually the #1 key determinant of health, and health actually improves at each step of the income and social hierarchy. And in addition to that, an individual's perception of their own health also increases as their income increases. And even though Canada does have a universal healthcare system, generally equal access regardless of income, these perceptions do still continue to exist. Poverty is one of the greatest barriers to good health. Approximately 22% of premature life loss is attributable to income differences. And people living in poverty, they tend to have fewer assets, less resilience, fewer chances to actually break out of the poverty cycle, and the longer amount of time someone spends in poverty actually decreases their chances of escaping the poverty cycle. It's estimated that in Canada, approximately the cost of poverty is about $72 to $86 billion per year. So I kind of touched on how poverty is directly related to health. I didn't go into this into great detail, but people living in poverty are more likely to die from injury or illness at every stage of the life cycle. People living in poverty tend to have higher prevalence rates of certain conditions such as asthma, hypertension, COPD, diabetes, arthritis, depression, and suicide. And not only do they have higher incidence rates of these certain types of conditions, they also have a greater chance of suffering from multiple chronic conditions, so suffering from something like asthma, hypertension, and COPD as opposed to just asthma. People living in poverty also have higher prevalence rates of lung cancer, oral cancer, and cervical cancer, and also tend to have lower cancer survival rates. Infant mortality rates are actually 60% higher in the lowest income quintile neighborhoods compared to the highest. So, I don't know if you can see this here, but I wanted to define poverty. So what is poverty? Canada actually does not have a government-mandated line of poverty or definition of poverty. And poverty is generally defined in terms of absolute or relative. Absolute poverty refers to an inability to meet basic needs, so not able to purchase food or shelter. Relative poverty is the distance away from the community norm or average, so how much money I would make in comparison to the group. I did find a generally agreed upon definition, which is that poverty in Canada refers to the intersection of low income and other dimensions of social exclusion, including things such as access to adequate housing, essential goods and services, health and well-being, and community participation. So, Statistics Canada uses 3 measures to report low-income lines, and these 3 measures are reported both before tax and after tax, and they are the low-income cutoff, or LICO, the low-income measure, or LIM, and the market basket measure, or MBM. So LICO, the after-tax LICO, is the most commonly used and widely recognized by Statistics Canada and most well-established. The LIM is good because you can make international comparisons with that, and the MBM takes regional differences into account. But they all rely on different thresholds and different ways to actually determine a low-income line, so they do tend to vary. And to give you an example of how these different measures really are different, I wanted to include this table from Nova Scotia's Vital Signs. And if you look at the poverty rate in Nova Scotia in 2009, using the after-tax LICO, the poverty rate is 8% in Nova Scotia compared to 9.6% in Canada for the same year. So using that measure, it looks like the Nova Scotia poverty rate is actually below the national average. However, if you look at the limb at 16.9% compared to Canada's 13.3%, and the MBM at 13.1% compared to Canada's 10.6%, Nova Scotia actually has a higher poverty rate than the Canadian average. And also, if you look at LICO at 8% compared to the limb at 16.9%, the poverty rate in the province of Nova Scotia has just doubled. So all of these measures, they're all used, they're all accurate. There's none that's really more correct than the other. So they all paint a very different picture of the state of poverty. And with that, I just wanted to kind of talk about the current poverty state in Nova Scotia. So the poverty rate in Nova Scotia is actually the lowest right now that it has been in decades, and the trend is that it has been continuing to decline. Currently, using the after-tax LICO, the rate is 7%, 11.5 for MBM, and 12.9 for LIM. I also wanted to mention unemployment rate. Nova Scotia's unemployment for the most recent data is the 2012 fourth quarter, and it was 9.1%. There are regional differences in unemployment rate. It ranges from a high in Cape Breton of 15.5 to a low in Halifax of 5.4%. The regional differences in unemployment rate isn't really mirrored with poverty rate. Any documents that I could find didn't really show a great variance in poverty rates in different areas of the province. Also, I wanted to mention that 1 in every 3 food bank users in Nova Scotia are children, and that leads me to vulnerable groups. So these actually aren't specific to Nova Scotia, these are Canada-wide, and the groups that are more likely to be living in poverty are children, unattached individuals, lone parents, people with a disability, Aboriginal Canadians, African Canadians, recent immigrants, and seniors. And they're all vulnerable groups for different reasons. Another group actually is women. Women do tend to be living in poverty more often than men. And the group that is actually at the greatest risk and tend to have the highest rates of poverty are unattached African Nova Scotian women. Having multiple characteristics from one of these groups does tend to magnify poverty, so it tends to increase your chances or likelihood of living in poverty. And that brings me to the recommendation for the poverty intervention tool. So this is a tool that has been adapted from an Ontario model. It was implemented in Ontario in 2013. It was designed and developed by Dr. Gary Block. Since being implemented in Ontario, it was also implemented in Manitoba. And what it is, it's a clinical tool for primary care physicians, so for a family doctor or GP. And it consists of 3 steps. So the first step is to screen, and that is to screen each patient for poverty. So as I mentioned before, there's different vulnerable groups of people living in poverty. There's different measures of poverty. There's not really a generally agreed upon definition of poverty. It's not always obvious as to who is living in poverty. So the goal of the first step is to screen each patient and ask them questions such as, are you having trouble making ends meet? Are you living paycheck to paycheck? Just to help determine who may be living in poverty and who is maybe at risk for living in poverty. Now the second step is to adjust risk. And that is to bear in mind what I'd mentioned before, that people living in poverty tend to have higher prevalence rates of like COPD, arthritis, hypertension, suffering from multiple chronic conditions, higher infant mortality rates. So it's just for the physician to bear that in mind, that people living in poverty do face different challenges and do or may need to be treated differently. And then the third and final step of this model is to intervene. And that could be as simple as the patient or the physician reminding each patient to fill out their taxes. They actually did that in Manitoba, and I don't know the exact figure, but the province was actually able to generate thousands of dollars in revenue just by reminding people to fill out their taxes. And this is still being discussed in Nova Scotia, how it will be implemented, but they're thinking of making it a community-specific model. So that way it could be as simple as a physician giving their patient a pamphlet saying these are the community resources and services that are available to you that are close by. So it is still being discussed and developed at this time. And that is all I wanted to talk to you today about. And I also wanted to thank Kathy, Victoria, Betty, Michael, all of the faculty and staff, and also the class. I've learned a lot from all of you. I also wanted to thank my practicum supervisor, Christine. She was amazing. And I also wanted to thank my husband and family and friends who are watching at home in Nova Scotia, so hello. And next, I'd like to turn the floor over to you and ask if you have questions for me.
So, questions for Kady?
I just wanted to make a comment. Thanks for ending off with some way we can take action, and with the screening tool for poverty. Is because I guess Catherine commented about how we can feel hopeless, and then that leads to inaction. So I really appreciated that, and I was just wondering if you had any examples of that in use, or any, or you said you had a practicum that had a lot of experiences, or if there's anything else that was unique to your practicum that you wanted to share outside of this.
Thank you for the question. Yeah, my practicum, I learned a lot about the advocacy piece, which was really crucial to me. My area of focus for the degree is actually health informatics, so this field of social policy was just kind of completely new to me, and it was so exciting. And I really learned how important your voice is and how to kind of help get people involved. And like, even though you may think, this is how I feel and it doesn't matter, but it does matter, and that you can kind of be the one to start that ball, get things rolling, and kind of help change things in a better way. When I was doing my practicum, I also got to see the Nova Scotia alternative budget from beginning to end. I helped do a little bit of work for that. And to me, that was so important and so interesting, because I got to see actual feasible options of how the government of Nova Scotia could allocate their budget differently and more effectively. And it was just such a great experience. I feel like I learned so much, especially about the advocacy piece. And I would really strongly encourage anyone going into the public health profession to check out the Canadian Centre for Policy Alternatives, because they have wonderful recommendations, very, very smart group of people, and yeah, just the advocacy piece is great.
I should have been watching, but I was so captivated by what you were saying.
This is actually the oldest operating lighthouse in North America. It's Sambro Island Lighthouse, and that's where I'm from.
Thank you for your presentation. I love how optimistic you sound, and the smile on your face is really encouraging. How do you feel with the Canadian Centre for Policy Alternatives? How strong do you feel like their voice is in Nova Scotia or in Canada? Your impressions from your work term?
Thank you for your question. I'd say pretty strong. I feel like not everyone knows about them, and I was surprised when I found out about them as well. I didn't know about them until just really before beginning my practicum. So I feel like, yeah, their name isn't really overly out there sometimes, but they really are making a big difference in the community. Actually, one of the last meetings that I attended with my practicum supervisor was with the Nova Scotia Minister of Finance, and they were proposing ideas from the alternative provincial budget. And yeah, there's just that advocacy piece. They really are like trying to involve themselves with the media, things like that. They're available on Twitter, Facebook, and they always make their reports available to people. So they do a lot of different reports, like assessing the gap between the rich and the poor, things like that. There's just a ton of things available online, and I think they are really kind of pushing to get their name out there and be recognized.
Except that friends and family in Nova Scotia wouldn't be able to hear.
Thanks for that. Poverty is a very important subject. I guess my question is, in Nova Scotia, is there any, because you were talking about chronic disease and its association with socioeconomic status, because I know in Saskatchewan, they've kind of started mapping that. Are they doing that in Nova Scotia? Like looking at...
Thanks for your question, Cheryl. I know I did come across a little bit in my research. I didn't touch on too much about poverty and health just because it's so broad, so I just kind of wanted to kind of scrape the surface of that and mention it. I did come across a few like maps of which areas are low income, high income, and the services available to those different groups of people. Yeah, so a little bit. I'd say there's probably more out there than what I found, but as far as I know.
I don't think all provinces are doing it.
Yeah, I don't think so either. Yeah. Any more questions?
Okay.